Stronger Together is about confronting the realities of youth suicide. And what inspired us to do this event today is the power of lived experience. I have seen in my research firsthand how many young people and their families often feel unheard, unseen, and unsupported at the time of when they're most vulnerable. We're hoping to bring together practitioners, those with lived experience, family members, and researchers to have an open conversation, a dialogue about the complexities behind youth suicide.
Youth suicide is something that's increasing. Everyone's going to have a different experience, so I think the more people researchers talk to, the more they're going to hear different perspectives and how it affects different people.
When it comes to youth suicide prevention, it can be quite a hard conversation to have with young people. As the days go by, the numbers are always going up, so it's important that lived experience people are being included in the research project and I guess empowering us to make our voices heard.
If there was to take one thing away, it would be what's behind that smile. What are they really saying? So I think if we can really be mindful of psychological safety, I think if there's one thing, it is that. All any of us want to do is help and support. We're all in this together.
My one takeaway would be, don't give up hope. I find it encouraging. We've been missing the voice of the young people for a long, long time.
I think lived experience is an expertise that you can't get from any data or any form of journal articles. It is something that is so fluid and unique to each person.
A key challenge sometimes is the disconnect between young people's lived experience or the systems that are in place that are meant to support them. There are many young people who do not seek help when they are experiencing self-harm or suicidal thoughts because of the shame and the stigma attached to suicide. Those who do seek help often are faced with many challenges in accessing the right help and support when they need it.
I know when I was younger, like a teenager, I had no idea about mental health research. I had no idea what it was, what was happening in it. I didn't realise that it was kind of being researched into things that I was going through. And I think being someone with lived experience, you obviously understand it from having that almost like insider perspective. And I think using that to help shape research, whether it's thinking about proposals or ethics applications or research questions or topic guides, whatever it is, I think it just brings a different perspective.
I think in terms of the key takeaways was just everything, the whole event, and actually the safety around. You know, you provided such a safe, a nice, a warm platform for everybody to share and to open up the panel as well. You had a mixture of different people, different disciplines.
For people in the room, I hope this event will make them feel more heard, seen, and empowered to take action in their local communities. For the wider community, I'm hoping that this event will change the narrative of suicide and the public dialogue, seeing a shift from silence and stigma to compassion and care.